Hello, welcome everyone to our meeting about our new electronic health medical records. I am so excited to give this overview regarding our new system because this has been highly anticipated and we are going to be rolling this out here in the next few weeks. Each department has their own rollout date, and in the next 6 months, the whole department or whole clinic wide will be on this system working as a unit. So I wanted to kind of bring everyone together to kind of give a brief overview of the great benefits, because ultimately our number one goal is to give the patients the best care we can, and this is really going to help establish that and promote that. So first is that we are going to have a scheduling system that is built into our new healthcare records, and this is going to have a built-in template for each provider, so that way it is going to help with any scheduling errors, and it's also going to help with ease of access for schedulers, so they can get patients in when they want to be seen. Second is we're going to have our patient records put into the system. So obviously right now we're on paper charts, but we're going to take the last 2 years and abstract them into the system, so that way each patient will have kind of their medication list in there. They'll already have their allergy list in there. Any lab results, they'll be put in there as well. Vaccinations will be put in there. Another great thing for having these patient records in the system is that it's going to be help with medications, so that way we know what patients are taking. It's going to have any doctor's plans already going to will be able to be read, and we can implement those plans in case a physician is on vacation or not in the office that day. We are easily able to look into the patient's last chart note to see what the physician had for a plan, because it's sometimes back when we were handwriting everything, it was easy to decipher incorrect information, and so having everything hand typed is going to be a lot easier for everyone. Third is that we are going to have a care everywhere. And so what the care everywhere is that it takes all of Washington State's hospitals, clinics, everything, and it is all attached to one system. So that way, if a patient goes to another hospital or goes to another clinic, we will be able to have access to their records. Same thing as they'll be able to access our records as well, because we have patients, who have a list of medications a mile long, and what happens if they don't remember the medications? Same thing for allergies, if they don't remember their allergies. Another nice thing about the system is that it's going to let us know of any contraindications that can happen with medications. Because sometimes new guidelines come out and we don't prescribe certain medications often enough to know all of its side effects. And so we want to make sure that we are providing the best care possible and making sure that patients do not get injured. So the system is going to help with that. Another great thing is that if anyone has any radiology exams, the radiology exams, the pictures are going to be put into the system, so that way we can just pull them up. So if they have anything in Washington, like I said, with the care everywhere, same thing is medications. Medications will be in there, allergies will be in there, any radiology exams will be in there, and so will any lab work or blood tests will also be in there. Vaccination records as well. So if they go to the pharmacy and get flu shots, or if they go and get pneumonia shots, or if they're going to be traveling, everything's going to be put into one system, which is really going to be very helpful. Another great thing about our new system is that there's going to be a way for the patients to have access to their health records, and this is going to be great because if patients can have access to their lab results vaccines, their last medical record notes, and they can also email their physician or providers if they have any questions. There has been many times where they're at a doctor's office and let's say for whatever reason that maybe the doctor's off, maybe wherever they're going isn't quite it with their electronic health records yet. They can at least pull it up on their application on their phone and say like, oh no, here's what my physician said last, and here's the medication list that I have. And this helps kind of hold the patients responsible too, so that way they can feel like they've got some control over their health care. Another great thing is that they, with the emailing system and able to ask physicians questions, this is going to help with any phone traffic, because we have often had times where we've got a queue, especially in the morning, depending on what department you're in, more so than others, where people are on hold for 5-10 minutes, and people are just frustrated. And so this allows for people to email their doctor a question, or if they want to schedule an appointment, they can email the scheduling department and say, hey, please contact me for an appointment. And actually in the next couple of years, there is going to be a way for the patients to actually look at our schedule and make an appointment for themselves. We haven't ironed out all of the kinks there yet, but that is to come. But don't get panicked. We will definitely have much more information before we allow this to ever be implemented. Another great thing is that we are going to, now that we are with the whole electronic health system, so we are really going to be focusing on broadcasting our company on social media, because there are 7 billion people in the world, according to Global Health, and 3 billion of them are on the internet, and 1.6 billion of them have social media access. And so this, we want to be able to kind of get to our patients if we can, especially those who are on social media. And we want to, so I thought, it'd be great to, if we have new providers who are starting, we can kind of put a biography on the various social media pages. Any interesting articles that come out, like, better nutrition articles, or how to kick the smoking habit, or immunizations, or like disease breakouts, we're able to put those articles on our website or on the social media website, and then patients can have access to that and learn information about that. Another thing that we'll do when it comes to broadcasting on social media is that during our flu clinics and during flu season, we will be posting and promoting our flu clinics. So that way our patients know when the flu clinics are happening, and so that way they can pick the day that's best for them. Especially, for our pediatric department, when there's no school, is that we want to make sure that, we take advantage, and so parents can know that they can come in to the clinic and get the flu shot done and not have to miss any school. So bonus. So overall, I realized that starting a new EHR system is quite nerve-wracking, but I think that if we can all stick together and kind of learn at our pace, and I think that we will really have set our minds at ease and know that this system is really going to help benefit our patients. Thank you. Have a nice day. Bye-bye.